In Chapter 4, we're going to look at drugs related to hypothalamic and pituitary hormones. I will tell you that there are some very specific things that I want you to pick off of this table and be prepared for on your exam. But nothing is more important than the drug octreotide. It's important enough that I'm going to give it its own slide coming up next to discuss the properties and the use of this drug. If you go a little farther down, take a look at the use of bromocriptine or another drug that I'm mentioning, cabergoline, for hyperprolactinemia. Remember that dopamine is our natural inhibitor of prolactin, and today cabergoline is the most commonly used drug for hyperprolactinemia. On the other hand, do you remember that dopamine receptor blockers can actually raise the levels of prolactin? We talked about those back in antipsychotics. If you go to the bottom of the table, there's vasopressin, commonly in the form of desmopressin, which is the drug of choice for central diabetes insipidus. We discussed diabetes insipidus back in the diuretic chapter, where we were discussing the use of thiazide diuretics in nephrogenic DI. Desmopressin, the drug of choice for central diabetes insipidus, and it's also used to distinguish central from nephrogenic. If you respond to desmopressin, we would diagnose you with central, and the lack of response says that you have nephrogenic. Desmopressin is also used for hemophilia A, for von Willebrand disease, and it's a major drug for primary nocturnal enuresis, where TCAs are sometimes also used. We'll use this slide to look at some of the uses for octreotide, a long-acting somatostatin analog. We see this drug asked about on the test for carcinoid syndrome treatment. Can you recognize carcinoid tumor and then, of course, carcinoid syndrome? The primary tumor, for example, occurred somewhere in the small intestine or perhaps in the appendix. And when you get metastasis to the liver, you get flushing, diarrhea, and high levels of serotonin indicated by the metabolite 5-HIAA. Make sure you know octreotide is useful for not only carcinoid but other secretory tumors. A second use for this drug is in the treatment of acromegaly. We can also use dopamine agonist for acromegaly, but today octreotide is more popular. We know that acromegaly is associated with increased levels of growth hormone, but a more specific test is to test for increased levels of IGF-1, since IGF-1 mediates many of the effects of growth hormone. The third use for octreotide, bleeding esophageal varices, because of a vasoconstrictive property of this drug. When you start patients on octreotide, they can certainly get GI upset, but you definitely have to watch out for gallstones with this drug. In the margin is a clinical correlate about drugs used in SIADH. This includes dimeclocycline, which is a tetracycline antibiotic that can specifically block vasopressin V2 receptors, and also the drug tolvaptan. There's a family of drugs out now called Vaptans that all block the V2 receptor in the collecting duct. Most commonly today, dimeclocycline is going to be used for SIADH, which could have been caused by various types of cancers, and we even have certain drugs that can cause SIADH. Specifically, some cancer drugs like vincristine and vinblastine can do this. You might also remember that we covered a drug back in our anticonvulsant chapter. That was the drug carbamazepine. Loop diuretics, salt tablets, and fluid restriction can also be useful strategies in SIADH.